Welcome to the MACRA Quality Payment Program Overview. I am Beth Radtke, Manager of Quality and Research Initiatives at AAPM&R, and I will be walking you through the basics of one of the most extensive changes in physician payment policies in the last 2 decades. MACRA, otherwise known as the Medicare Access and CHIP Reauthorization Act, modernizes fee-for-service and replaces the sustainable growth rate. The new quality payment program will begin January 1st, 2017. In order to understand the quality payment program, we need to take a look at a set of goals announced by the Department of Health and Human Services back in January 2015. This was the first time that specific goals were set to tie quality and value to specific payments made under Medicare. And these 2 goals tie directly into the work that is happening under the quality payment program, including the Merit-Based Incentive Program, or MIPS path, and the Alternative Payment Model, or APM path. The first goal of tying a certain percentage of payments to participation in an APM ties directly to the APM path of the quality payment program, and Health and Human Services has already met the goal of 30% for 2016. They are well on target for meeting the goal for 2018 of having 50% of payments tied to participation in an APM. The second goal of tying quality and value under the Medicare fee-for-service program directly relates to the MIPS path of the quality payment program, and those goals are to have 85% of payments tied to quality and value by the end of 2016 and then 90% by 2018. Before we move forward, we also need to talk about Medicare payments prior to MACRA. As many of you know, MACRA replaced the Sustainable Growth Rate, or SGR. In the current system, there are multiple quality and value reporting programs. These include the Physician Quality Reporting System, PQRS, the Value-Based Payment Modifier, VM, and the Medicare Electronic Health Records Incentive Program, EHR. MIPS, which was authorized by MACRA and is one of the arms of the Quality Payment Program, does a number of things. First, it streamlines and sunsets 3 of the programs that most commonly impact providers to date. Those include PQRS, VM, and EHR. Those 3 programs will end with 2016 reporting, and MIPS will begin in 2017 with payment adjustments in 2019. The updated programs under MIPS are quality, resource use, advancing care information, and a new component, clinical practice improvement activities. CMS hopes that MIPS will provide flexibility to eligible clinicians by allowing them to choose activities and measures that are most meaningful to them. Another arm of the quality payment program is alternative payment models, or APMs. APMs are new approaches to paying for medical care through Medicare that incentivize quality and value. As defined by MACRA, APMs include the CMS Innovation Center model, Medicare Shared Savings Program, demonstration under the Healthcare Quality Demonstration Program, and demonstration required by federal law. When you think about the 2 arms of the quality payment program, there is the MIPS side and then participation in an APM. The intention is that over time, more and more clinicians will be part of an alternative payment model. However, for the first year and few years under the quality payment program, the majority of clinicians will be part of MIPS reporting. So how will the quality payment program affect you? If you follow along with this chart, you will see the different ways in which you can participate through either an APM or MIPS. Bottom line, you will need to participate in the quality payment program. Reporting quality measures will be tied to your Medicare Part B payments no matter which path you take. Finally, a few key takeaway points. The quality payment program changes the way Medicare pays clinicians and offers financial incentives for providing high-value care. Medicare Part B clinicians will participate in MIPS unless they are in their first year of Part B participation, have a low volume of patients, or participate in an advanced APM. And although reporting begins January 1st, 2017, these adjustments or bonuses will not begin until 2019. Thank you for joining us. We understand this is a complex topic and you may need more information. Your Academy wants members to thrive, not just survive, as new healthcare models are being tested that pay for performance and quality care. Visit www.aapmr.org or email your questions to healthpolicy@aapmr.org. Be sure to join us at the 2016 Annual Assembly in New Orleans on October 20th to 23rd for in-depth MACRA content. And visit our website often. We are constantly adding new information.